Residents of Nairobi, especially those in informal settlements, are now enjoying free medical services following the improvement of health services in the county. The opening of 5 new hospitals by President Uhuru Kenyatta on 6th July 2021 was billed as an indication of the government's commitment to expand health services in the city. The president commissioned 2 Level 2 hospitals, namely Gishagi in Kangemi and Gatina in Kangware, and 3 Level 3 hospitals in Mukuru kwa Ruben, Tasia kwa Ndege, and Mukuru kwa Njenga. The president had commissioned 6 hospitals earlier, bringing to 10 the number of new hospitals commissioned.
During our tours around the city, we found that one of the biggest problems that we have is access to healthcare. And I decided that it was important that we have the capacity to give healthcare to where people are, because the majority of Nairobi's citizenry had only Kenyatta National Hospital and Mama Lucy.
The new health facilities are part of 24 hospitals being constructed by the Nairobi Metropolitan Services as part of a broad government plan to avail health services closer to the people while decongesting Kenyatta National Hospital and the main county hospitals.
Under Ministry of Health, there was always a referral policy of the basic dispensary or hospitals referring their patients to Kenyatta Hospital. But that was not working because there was no hospital to refer them to Kenyatta. So every mwananchi who had minor problems took a boda or a taxi to Kenyatta to be attended to. This made Kenyatta Hospital leave their specialized duty and attend to basic medical health care.
We have 19 hospitals that are coming up from the ground. Then we have 5 hospitals that were abandoned. They started during the previous county governments, the first county government, the second one, and then they were abandoned. We took them over and we are also finishing them. We have already finished the one in Lungalunga, we finished the one in Riruta, awaiting commissioning. Then we have the 19 that are coming up from the ground scratch, where these are purely in the informal settlements, where we had to go, we had to identify land, we have to build. Out of these 19, 10 of them are level 3 hospitals, and 9 of them are level 2 hospitals. Out of the savings, we are also doing 3 other facilities, which is the one in Madare, Gumba. We are doing the one in Makina, and then this one in at Green Park, which is additional hospitals.
Health is one of the 4 functions NMS took over from the county government of Nairobi. Others are county transport services, county public works, utilities and ancillary services, and county physical planning and development. NMS came into being in March 2020. The same month, the first COVID-19 case was reported in Kenya. Health therefore became a top priority for NMS. Apart from sinking 100 boreholes immediately in the city to help the vulnerable have access to clean water that was crucial in the fight against COVID, NMS also prioritized improvement of health services.
We saw the difficulty, especially on maternity issues, that was affecting the larger population of Nairobi that lives in informal settlement. So while going around to take stock, we realized, apart from Kibera and Madare, which had some sponsored clinic by different NGOs, the other slums had nothing at all. That is why we went back to the drawing board and decided to request for funds to build 24 hospitals. Apart from that, we are also rehabilitating the dispensaries which were run down by the county in terms of maintenance. So the little funds we have, we are upgrading some of them.
The new hospitals cut across the 17 sub-counties in Nairobi. By mid-July 2021, the new health facilities had served over 70,000 patients.
Just to give you an example, in Udhiru, after opening the hospital, the first month, the hospital recorded 4,000 patients within a month. That shows you the demand of healthcare that is there in disadvantaged areas and informal settlement.
Nilikuwa nimekuja leo hospitali juu mtoto alikuwa mgonjwa tumbo, alikuwa anatapika na kuendesha sana na alikuwa na joto mingi. Nikaona leo nimlete hospitali ndio nipimiwe nijue shida ni nini, lakini nilipofika nimehudumiwa vizuri, nimepewa madawa na nimeambiwa shida ilikuwa nini.
Hospitali ni nzuri, kuna madawa, kufika ni karibu, hatuchoki. Hata mtoto akigojeka ukiwa kwa nyumba unamkimbisha na anatibiwa haraka.
We do not charge people here. All our services are free, which is a very big plus to the country. And so far so good. And I'm grateful to the President and NMS at large and the medical fraternity. As you can see, it's one of the state-of-art buildings. It's a very beautiful building. The services that we offer are very good. Even the equipments that we have are up to date and of the best quality.
In Kayole, there is Soweto, a level 3 hospital too.
Kitambo tulikuwa tunaenda Kayole 1 kwa dio huko chini ukielekea Masimba. Ilikuwa ni mbali, but sasa hii tuko na hospitali hapa karibu ambapo itasaidia Soweto community. Itasaidia sana.
Since we opened this facility, laboratory services have been opened for them. We have pharmaceutical drugs which are available, and since we are getting support from KEMSA, most of the drugs are being dispensed here for free. We are getting pediatric services here free of charge. Almost all our services are free.
Level 2 and 3 facilities are completely free. And this is the guarantee we are giving to the citizens, that they will come there, they will find a doctor, they will find a nurse, they will find laboratory care, a basic laboratory, they will find basic imaging in level 3. They'll find an ultrasound, they'll find an x-ray at a level 3 facility. They'll find a doctor, they'll find a nurse, they'll find a clinical officer, all for free. At level 4, we have what is called cost sharing. So they'll pay a service fee for surgeries that are not cesarean deliveries, for HIV services, TB services, all maternity services in level 4, they are free. So we are building the hospital, we are employing the healthcare workers, we are equipping the facility, and then we want the person who is coming there for free to have an NHIF card. So this NHIF card, those who are able to pay for themselves should pay for themselves, but then there are also families who are completely not able to pay for themselves. So we are paying for them. So what that means is that if we do not tie them to enrolling people in NHIF, that they have a card so that we could over time be billing NHIF on a reimbursement model, then they're not going to be sustainable.
The level 5 hospitals offer inpatient services with a 16 to 25 inpatient bed capacity, a maternity theater, and a digital X-ray unit with capacity to attend over 100 sessions a day. They also focus on primary health care, community health services, and chronic diseases.
Mama Lucy, we have just finished procurement of building a new wing, and we have got some equipment like ICU equipment from World Bank donation. With the equipment and the new facilities that we are building, we should be able to upgrade Mama Lucy from level 4 to level 5. It's actually now operating at level 5 because of the facilities that it has. Both Mama Lucy and Bagathi will be upgraded. And we took over a building, Korokocho Hospital, that started 2 decades ago. Unfortunately, all from the second president, third president, that project It took off the ground but never saw completion. So that is going to be turned around because the hospital has got 350 bed capacity with a complete wing for children, a complete wing, one whole floor for women, one floor for men, and one floor for the notorious border accidents.
The Level 2 health centers offering outpatient services have full antenatal services, child welfare, laboratories, clinic, HIV testing and counseling, all with a capacity to have 200 people attended to in a day.
We also discovered that Nairobi hospitals opened at 8 o'clock in the morning and were closed at 6 o'clock in the evening. Meaning that therefore, those few hospitals that were actually available within the city of Nairobi, if somebody got sick or was in need of medical attention, it meant that if it was after 6, the only facility they could access, again, was Kenyatta National Hospital. So we decided that it was important that these hospitals that we are building operate on a 24-hour basis.
Kitambo tukuwa tunapata matibabu usiku, lakini kwa saa hii saa 3 ya usiku nimepata matibabu vizuri, nimehudumiwa, nimepata madawa.
It is 24/7. Yani hata ukifika unawana kushughulikia. They are so committed to you or wakikuadmit. I loved the place. In the past, hatukuwa tunapata huduma kama hizi. There's much improvement.
The new developments are expected to ease pressure on Kenyatta Hospital.
Kenyatta Hospital has got fantastic equipment and they can concentrate on their main objective, that is to treat cancer, major operations, major surgeries, and so forth. So we should be able to decongest the problems of healthcare so that Kenyatta Hospital now becomes a teaching and referral hospital.
By extension, the Level 5 and Level 6 hospitals are expected to provide opportunities for training.
Korogocho is going to be a teaching and referral. It has already been seconded to Kenyatta in terms of referral. We have even signed an MOU with JQAT where they'll be attaching all their qualified doctors to Mathare because of proximity. We have given Kenyatta University and JQAT permission to use Mama Lucy Hospital also as a referral and teaching. So yes, for us it's a great advantage because we get all the interns to go there. So the workforce, a lot of people go to Mama Lucy and we do hope we'll be going to Korokocho. So with extra hand from the university, we think we can achieve a lot.
The new facilities have necessitated demand for more health personnel.
We have employed 179 doctors. Out of this, 130 of them are medical officers or general practitioners, and 44 are specialists. The Ministry of Health also, through the UHC program, gave us additional 28 doctors who are also general practitioners. So in total, we have employed 207 doctors. Then what we've also done is that we've employed 1,000 nurses. Out of this, we had 1,400 nurses. We've added additional 1,000 nurses. 679 of them are what we call enrolled nurses, so basically the diploma level. And then we have another 80 of them who are degree level. And then we have around 200 of them who are specialist nurses. There are 7,320 community health workers, and we just recently gazetted the Community Health Act in Nairobi to operationalize this so that we are able to link up with communities.
Health volunteers are called whenever there is a pandemic like COVID and all for enlightening the population and of course helping in observing the COVID rule. but the health volunteers are very many in Nairobi. And if we have to take each and every one of them, then we won't be able to pay them as per our resources. So this is something we have sought help from different medical NGOs, and currently they are helping a lot in meeting their salaries.
Hey, habari yenu? Mambo kabisa. Unajisikiaje?
Nasikia hata mtoto anafurahi na dunga kidogo kidogo. Anadunga amefurahi leo.
Amefurahi.
Uhuru anakuja.
Anakuja. Tunakutakia na yeye mema.
Amen.
Si ndio?
Hata nikatakia amani na mema.
Asante. Mungu akubariki.
Amen.
Na wewe dada.
Affordable healthcare for all was part of President Uhuru Kenyatta's Big Four agenda. Therefore, the launching of the new hospitals in Nairobi is a big contribution towards that agenda.
Hii ndio the first facility ya hospitali ya government hapa karibu.
Hospitali yenyewe ni nzuri, madaktari ni wazuri.
Ni bure, hakuna malipo yoyote.
Hatuteseki kama kitambo.